Hello.
Hi, everyone.
We are back this week to talk about a topic that we've got asked about. I feel like we get asked about at least once every moment for mom,
Yeah, if not more.
which is talking about scheduled C-sections. And so we just wanted to break down a little bit more about scheduled C-sections. What we really want to cover is like reasons why people have a scheduled C-section. Now, the tips that we're going to give aren't just for people having scheduled C-sections. They're for anybody having a C-section, but obviously most times, especially with your first baby, if you end up having a C-section, it's usually unplanned.
Right.
So this could be like if you're listening to this and you have a scheduled, because you have a scheduled C-section, but you have a friend who maybe just had a delivery that was an unplanned C-section, then maybe it's worth sending it to somebody like that, because there's some tips in here that apply to everybody who has a C-section, but we oftentimes get asked about like how to actually prep for and things that you need for a scheduled C-section.
Also, if you're listening and you're pregnant, don't skip ahead to the next episode.
Yes.
I
just listen.
Yeah, I mean, we always say this in pre-baby boot camp and all of our classes. We cover everything in our childbirth classes, from vaginal deliveries to C-sections, natural births to pain management, like a sprinkle of everything.
Right.
Because you just, you don't always know how it's going to go in your scenario. And so while you can plan for certain things, there are times that things go a different course. And I am very confident that one of the biggest things that our moms say to both of us after they've had their baby, if they did have a C-section and they weren't planning for it, is that they wish that they had known more. They say it all the time.
They hadn't skipped that chapter.
So don't skip the episode.
Yeah.
Listen to the whole episode.
Yes.
It's probably helpful to start with, why would you have a scheduled C-section? I think many birthing classes talk about why you might end up with a C-section. Correct. But at baseline, why would you have a scheduled, planned C-section?
Yeah.
That's like a dentist appointment. Like, the date, the time, it's on the calendar.
I mean, there are like top two reasons that come to mind, or are malposition of the baby, meaning like a baby who is breech. Most people think a baby who's breech, which would be butt down instead of head down. That's a reason to have a scheduled C-section, or sometimes they're usually head down, or sometimes they're like sideways.
Yep.
Or you had a C-section with your first and you're having, or a subsequent baby, second, third, fourth, and you are having a scheduled C-section for that reason. It's called a repeat C-section when you work on labor and delivery.
Yeah. I mean, there's definitely other reasons, but I would say those two are the most common.
Those are the most common. I mean, there are some people who schedule C-sections with their first, even though the baby is head down, because of a family history, because of surgical histories, because of
they might have a medical history, like maybe they have gestational diabetes and it's
a big baby.
And then there's just personal reasons too. Just like you can have a personal reason to want to be induced, you could have a personal reason to want to have a C-section.
Correct. So it's those are but talking about like the top two reasons, I would say it's either a repeat C-section or a baby who's breech. In terms of, so let's just break down, like in terms of what to expect when you go to the labor and delivery unit for your scheduled C-section. I think it makes sense to start there. So you're showing up at a scheduled date and time, although we have got asked the question, like if you're scheduled for a C-section and end up breaking your water or go into labor, you will still have a C-section.
You just have to go to the hospital.
You just have to go to the hospital and won't be on your scheduled time.
Sooner.
Like they fit you in to the schedule for the C-section.
They won't make you wait till that. They're going to still see you.
Right. But obviously, assuming that you make it to your scheduled date, what does that actually look like? And again, if this is like a repeat C-section because you went into labor, but didn't have a vaginal delivery with your first, it is really different, right? Like there's no anticipation of like when it's going to happen leading up to it. Right. You have the scheduled date, you show up, your nurse will put in an IV, you have an anesthesiologist and your doctor come and check on you before they actually go back to the operating room.
It's super calm and controlled. Everyone comes in, they want to say hi, they want to get to know you. And then you often walk back.
You'll get asked the same questions.
Yeah, you get asked the same questions 5 times. First, the nursing student comes in. Then the nurse comes in. Then the medical student comes in. Then the doctor comes in.
You're going to ask the last
Then the anesthesiologist comes in. So you just call them all in at the same time. You're like 1, 2, 3, 4, 5, get in here. But I was just saying, we used to have patients just walk back.
Yep, to walk back.
Get on up, walk on back to the operating room.
Your partner support person will wait for you there's usually like a pre-op area,
Recovery room.
or a recovery room. Yep. That they'll wait for you, to get into the operating room. They're going to give you your anesthesia, which is usually a spinal anesthetic. And, so they'll get that in, they'll get you prepped and ready for the C-section, make sure you're totally numb and comfortable. And then your partner usually comes back to the operating room, before the procedure even starts. Like your partner or support person will be there.
Right.
And then typically a C-section takes about hour and a half.
Yeah. I always say like an hour door to door, you know,
Yeah.
from one door to the next, like in and out,
Yeah.
basically.
But like the baby's out within usually the first 15 minutes.
Right. It's the finishing of, once the
Yeah.
baby's out, they need to then close all the layers and the muscle and the
Yep.
tissue. So that's what takes the longest.
So you actually will like have your baby with you, and either you will be able to do skin to skin in the operating room. This is a question that I would ask the hospital that you're delivering at. Like, what are their policies around the support person? What are their policies around skin to skin contact in the operating room? If you are interested, like a hot topic right now is like the gentle C-section. So if you're interested in having a clear drape to be able to see the baby being delivered, these are questions that you can ask about and find out the policy, for those things in the hospital before you even get there.
Yeah.
So if you want to have, some prep or control ahead of time, I think those are great questions to ask.
Just to clarify too, for people listening, the clear drape is very cool. They didn't have that when we worked as labor and delivery nurses.
Really cool.
But once you are comfortable, you're laying down and they put a drape sort of above your belly, so you can't see the surgery. Everything's sort of blocked.
Yep.
But the clear drape is they're able to have it so that you can watch as the baby's being delivered.
Yes.
And then they bring the baby around to you and your partner, and then they pull up a solid drape over the clear drape, so you're not now watching them sort of close up your abdomen and the rest of the surgery. It's super cool though to be able to see your baby coming out.
If I had a C-section and they offered a clear drape, I would I would watch the whole thing, I guess, but I would 100% watch the delivery. I mean, obviously Emily and I are a different breed. We are nurses. We learned labor and delivery, like loved all of that shit. But I think that's a cool option if that's something that you want.
Yeah.
And then once you're in the recovery room, like pretty much everything is kind of the same as like a vaginal delivery, meaning like you can still do skin to skin contact in the recovery room, hopefully off of the operating room. You're going to feed your baby. Like if you're choosing to breastfeed or bottle, I mean, regardless, but if you're going to breastfeed your baby, you're going to breastfeed for the first time in the recovery room. Your partner's going to be with you the whole time.
They're going to learn how to do the first diaper and how to pick up and swaddle the baby.
Yeah.
You kind of just get going right away. I think the biggest thing that people ask me is they're worried that they won't be able to breastfeed.
Yeah.
You are. And so, but yeah, no, we sit you right up, get 1,000,001 pillows and stuff them all around you. And babies are happy to latch in that first hour and go for it.
Yeah.
Honestly, it does them a little bit of a favor, because having an hour after delivery for them to transition and do skin to skin and sort of recover from birth helps for a successful first feed. And so by the time you get out of the operating room and are sat up to feed, you've had sort of that.
You've had that hour.
You've had that hour. Yeah. You're ready to go.
Let's talk about some, obviously, of like the major differences here, right? Like one is the actual time that you'll spend on labor and delivery before you go to your postpartum room, if those two areas are separate in the hospital that you're delivering at. And so typically like the recovery, the time where you're observed by the labor and delivery nurse and the anesthesia team is about, call it 2 to 3 hours following the C-section. You'll be closely monitored. Your heart rate, your respiratory rate, your
blood
pain,
pressure, your bleeding, give you medication.
And then once, you're deemed stable, which hopefully you're stable the whole time, then that's when you would go to your room that you'll stay on for the remainder of your stay with the baby. So that initial time that you're on labor and delivery right after the C-section is typically longer than if you have a vaginal delivery. Pain, right? Now, I'm not going to say actually that a C-section is more painful than a vaginal delivery, because Emily and I have been nurses and labor and delivery nurses long enough to know that there are some vaginal deliveries that are absolutely more painful and the recovery is longer than a C-section. Yeah. But when you're thinking about, if we're talking generally speaking, a C-section is a major abdominal surgery. Like, I feel like you and I say this all the time. I say it all the time.
You should get credit for it. People need to know it was a major surgery.
It's also just one of the only major surgeries that we don't recognize as a major surgery, it feels like, in the sense of how pain medication is offered to you, what rehabilitation and or resources you have available to you on postpartum. Like, think about anybody who has a major surgery.
I can tell you right now, my husband had a major surgery on his, was it his labrum, his shoulder, whatever. There was a lot of appointments about it. And he went and he had the surgery and it was a big deal to get him there and get him home. And I had all the meds written out on a schedule to make sure he had them on time. And, you know,
he had physical therapy.
He had physical therapy for many appointments following. And, you know, I think about a case like that and it's like, wow, the mom had a major surgery just like that guy. Who lived a very, you know, cushy recovery, I would say, but you don't even, nobody acknowledges it because you're taking care of a baby. And then you forget to take your pain meds. You forget to drink. You forget to do stuff for yourself because you're taking care of the baby. And then all of a sudden you're uncomfortable because you missed a dose or you didn't get up for a while. And, you know, it's really easy to let that kind of stuff happen.
There's no other surgery that results in the birth of another human being.
Totally. Right.
And so
very good point.
Right. And so like having a C-section goes against everything else that we say about somebody having any other kind of surgery. Because any other kind of surgery is
don't get up.
Take it slow. Make sure you're getting plenty of rest. Here are your meds in the schedule that you need to take them on.
Don't move your arm.
Here's a physical therapist.
Stay still for a week.
Here's the physical therapist is going to see you while you're in the hospital before
the baby,
you go
they're
home.
like, don't lift the baby. Like, don't lift anything. And you're like, but I have a baby. Or how about everybody listening that has other kids? And they're like, don't lift anything. And you're like, I have a 2-year-old at home.
Right.
I mean, oh my God.
So this is just the reminder of like, you had major abdominal surgery. One day we will change the way that we take care of and doctor mothers who have a C-section to birth their baby. But like, remind yourself of that. Stay on top of your meds. You are prescribed pain medications for a reason. Those pain medications are safe for you to take if you are choosing to breastfeed. And so don't skimp on your pain meds and ask for them, or let your, like, one tip is like, let your postpartum nurse know that like you want her to bring your meds to you and offer them to you on the schedule that they're allowed to offer them on.
When you're home, I always tell people, leave them on your nightstand.
Yeah.
And you may even need to set an alarm to remember to take them in the middle of the night, because what often happens is maybe you're up and you're breastfeeding the baby at 2 a.m. or something, and then maybe you do a feed at 4 or 5 a.m. and you forget that dose in the middle of the night. It's really hard to get up in the morning for the day. It comes 6 or 7 a.m. So if you don't have other kids, I used to tell patients, leave it in a dish on the nightstand. You don't even take the lid off. It's just right there. But if you have toddlers, keep the lid on. Or if you have big yellow labs that like to eat medications that you leave around your house, like mine. Don't put it in a dish.
No. So definitely stay on top of your pain meds. Find out what they're offering you for pain meds in the hospital. Ask your nurse to give them to you on a regular schedule so that you're staying on top of it. When you get home, you're likely going to go home with some prescribed meds, even if it's not something like an oxycodone. It will be something like it's called like it's an ibuprofen that's like 600 milligrams. It's the exact same thing as taking 3 ibuprofens, but it's just one pill. Okay.
And it's
so
covered by, you get it for free if you get it
covered by
insurance. By your insurance.
And like that ibuprofen isn't any stronger than the 3 ibuprofens. So just take don't think that you can't take it because it's stronger in some way. Just take it.
And if you need oxycodone, it's okay. I think a lot of people are worried that they don't want to take that right away, but all of our patients who have C-sections, they really just need this help in that first week home. And then even that second week out, they're already getting so much better. So just be kind to yourself that first week or 2 home. We obviously have to talk about choline.
I mean, on the topic of meds, this is the other
people are listening. They know
other
I'm
thing
with pooping, but like, it's so
But this is the other thing about like postpartum life, right? Is like when it's offered to you, it's like, oh, well, you can take this. And it's like, no, fucking take it. It's a stool softener, right? Whether you have a vaginal delivery or a C-section, but in particular for a C-section, surgery is putting you at greater risk of becoming constipated. And pain medications
and then delivery.
And delivery.
Just slows that gut down.
All these things are putting you at a higher risk for becoming constipated. there is, in my opinion, no downside to taking a stool softener.
No,
just make sure that
it's
you
not
drink
a
enough water.
laxative. It's
No.
not going to like your diarrhea running to the bathroom. It's
No.
just going to get your gut going.
It's just going to
The
make your poop
last
nice and fluffy.
shit you need, no pun intended, is like trying to push a poop out when you've had surgery. Ow.
Yeah, or a baby who came out of your vagina. This
Yeah,
goes
that
both
hurts
ways,
too.
right?
Totally, yeah.
So
take
Colace.
Colace or milk of magnesia or Senna, like whatever they offer you. Say
those
yes.
are laxatives, to be clear.
Whatever
But,
they offer.
Yeah, yeah, whatever they offer.
If and get a venti Starbucks.
Yeah, especially if you haven't, if
really
you had a
C-section,
usually there for like 4 nights. If you haven't pooped by the time you leave, like take that milk of mag.
Big guns.
Yeah.
Get the big guns out.
I feel like I had one more point about the stool softeners, but anyway,
you because I get really excited about this. It's just so important.
Just don't skip on the megs. It's usually like, oh, it's so this is what I was going to say. The way that that Colace is, the stool softener, is usually prescribed is twice a day as needed. Okay, so just like take it twice a day, morning, evening, have it be part of your pain medication schedule. Like just take them all at the same time. Okay. Okay.
I want to talk about your brain. You know, I have a story for this one. Like, here's what happens. So after you have a C-section, you're mentally like ready to rock. Like your brain is good. You have a little adrenaline rush because you just brought home the baby and you want to like get back out there. And a lot of people get super frustrated because they're like mentally, like their brain is ready to go and then their body can't keep up with them. Mm-hmm. So that's a sign to obviously slow down.
I even think for people, like this is for anybody, right? Yeah. Whether this you're having a C-section with your first kid, or I'm even thinking about the person who's having a repeat C-section who like maybe had a really shit labor the first time and like it was long, they pushed for a while, ended up with a C-section, like truly felt horrible probably following that delivery, and then has a scheduled C-section. And I am by no means saying that a scheduled C-section is rainbows and unicorns, right? But it's usually a world of a difference if that was your original original labor. Like this is your experience with the repeat C-section. And so even then it's like, oh my God, I feel so much, even though I had major surgery, I feel so much better than I did the last time.
You're ready to rock.
And you're like, I just want to go. Yeah.
I say, I don't know if my cousin Jess listens to this podcast, but she lived below me. She had a C-section and I just will never forget. I obviously didn't have C-sections. I had 3 vaginal deliveries. I mean, I'm talking about it. We teach it, but she really wanted to go for a walk and she looked good. She was feeling good.
Yeah.
We got the baby in the stroller. And I just remember we got to the top of our street. And
she's a hill.
It's a hill. It's a slow, gradual hill. And she just looked so pissed. And she just was like, ugh, I can't go any further. And then she looked like she was going to cry. She was all she wanted to do was walk downtown in Charlestown. Yeah. And I was like, it's really good that you made it to the top of the street. But like, she was like, this isn't like, she just wanted to be walking around town. And that was when I really like it sunk in even further. I obviously know this from teaching it for so long, but I was like, wow, like that really is like the brain is ready to go and the body just can't do it.
Yeah. So just remember that, give yourself time, give yourself grace. Yeah. Try not to get too frustrated with yourself if it's taking a little bit longer for you to get to where you want to be. And just remember, if you take the time when your body's telling you to step back, to take that time to rest and recover, then you are going to get to where you want to be faster than if you push it. Because if you push it, you're going to end up in a bad place.
Speaking of hills,
where are you going with
also want to avoid stairs.
You may not be able to avoid stairs, but limit the use of stairs if possible. Yeah, I mean, I love the suggestion of setting up the different stations in your home. Yeah. So if you are in a house that is not like a condo like Emily and I live in, although we do have some stairs, but not a whole lot.
Stairs, yeah.
Have like a changing station, feeding station, diaper station, like everything that you could possibly need, all of your underwear, pads, like the whole Victoria's biggest secret.
Right. And then the baby onesies, burp cloths, like if they shit themselves, a new outfit, the whole thing.
Everything you can have more than 2 locations, but definitely downstairs and upstairs.
Right.
So that if you are somewhere, you're not going upstairs every single time you need to change your baby's diaper.
Yeah. Once you come down for the day in the morning, like you're down for the day.
Yeah.
And then when you go up, you're up.
Yep.
So,
I do want to quickly go back to, things that you can do to help yourself just right out of the gates, even in the hospital or on the postpartum floor. One is I would ask your nurse, your postpartum nurse, or even your labor and delivery nurse, but your postpartum nurse is going to be the one helping you with these things. to show you different ways that you can breastfeed your baby so that your baby isn't, if you're choosing to breastfeed, cross cradle on your stomach, on your incision the whole time. Right. So like, I really like to show women who have had a C-section, especially the first few days, week, 2 weeks, the football holds. So holding the baby more towards the side, so that the baby isn't directly on your incision, right. Or even side lying in bed. Mm-hmm. Maybe a little bit trickier for a first-time mom, but if you've had other kids and you have actually done like sideline breastfeeding, those positions can be really helpful and really right. comfortable and not putting any more pressure on your C-section incision, causing you any more unnecessary pain.
Yeah, I mean, in the hospital bed, you don't even have to go all the way on your side. There's so many pillows.
Oh yeah,
they can like roll you a little bit and like kind of tuck them in so you're off of it, but yet like turn to the side and get yourself comfortable.
I'd also have your postpartum nurse show you how to get in and out of bed so that you're not using your abdominal muscles. So we're used to
scoochy situation,
right? So like we're used to, so let's talk about getting out of bed from like a lying position, right? We're used to just sitting up, right? Maybe not with pregnancy, right? Because we had this big belly. So right. like then you roll onto your side and you push yourself up with your arm. Right. Yep. So maybe when you were very pregnant towards the end of your pregnancy, you may not have even realized that you did this because you were so pregnant and you couldn't sit yourself up directly. And now maybe you just go back to doing that because it's a habit. Don't do that. You're using your abdominal muscles to sit up and that's going to hurt. Turn yourself to your side and push yourself up with your arm.
Yeah.
Right. And then you're going to swing your legs over the side and be able to stand up.
Scooch, right. slowly over to the edge.
Versus when you're getting into bed, you actually want to get into bed facing the bed and kneel into bed. So you want to kneel into it, kneel to the center of it, and then turn your body on your knees and then sit down. Yep. Versus getting into the bed on your butt, having to use having to swing your legs up and scoot yourself back, and that uses your abdominal muscles all the time.
If you have a really, really high bed, I've seen patients put like a basic step stool, like a sturdy one though, obviously, and just one step even. Yeah. So you can get on it and get in backwards. Yeah. Some beds are really high.
Yeah.
I've had moms sleeping on the couch because their beds are so high. They can't get into their beds. So they sleep on the couch. I guess it's the lesser of two evils, but
this is also a really good plug for having a good pelvic floor physical therapist. So pelvic floor physical therapist can help you in a C-section recovery for things like we were just talking about, like different positions for feeding your baby so that you're comfortable and not putting pressure on your incisions, getting in and out of bed, or just other like, activities of daily living, right? Yeah. Stairs even. They can talk to you about scar tissue massage. I
love this. Nobody ever talks about it or teaches about it. Even OBs rarely mention it just because there's other things that they have to cover. But I even saw a friend recently who showed me her incision and it was bothering her just because it was so much scar tissue. Yep. And I told her, I'm like, oh my gosh, you should go see a pelvic floor PT. They can actually give you exercises to do to break this down. She was tickled. I had no idea.
100%. Yeah. I also think there is a myth behind like leaking urine and having symptoms of incontinence is only for people who've had a vaginal delivery, or painful sex is only for people who have had a vaginal delivery. And that is not true.
Anyone who's been pregnant can qualify for all of these things.
You don't even have to be pregnant though, right? Like all of your abdominal muscles are connected. Your abdominal muscles are connected to your pelvic floor. So if there is a lot of scar tissue or adhesions that are pulling the muscles of your abdomen closer together, it is also causing tension on your vaginal, on the muscles in your vagina that can cause painful sex. Yep. Or just the stretching from being pregnant, can and pressure being on your bladder and surgery on your abdomen can also cause changes and issues with your bladder. Yeah. So that is not just for people who have had vaginal delivery.
The muscles are insane down there though. Like, so Alex Sagrado, who owns Boston pelvic PT, comes to boot camp, pre-baby boot camp, and she teaches a pushing section, but she does explain just the pelvic floor in general before she goes into pushing, and she pulls out this pelvis and shows these muscles and explains like how the abdominal muscles connect down in, and it's like a hammocks of muscles in like the rectum and the vagina areas, and you're just like mind blown. You're like, oh my God, and it makes so much sense. Yeah. But whoever like talks about those muscles.
Totally. Like, so going back to just on your team of people who you want like helping you or giving you advice, like postpartum, your nurse showing you how to get in and out of bed.
Yep.
Maybe different positions for breastfeeding on postpartum. A lactation consultant would be a great person to have. Again, you want somebody to come to your home. You're not driving anywhere. So have a lactation consultant come to your home.
And in your home, you can use your bed, your chair, your couch, right? Like your pillows. And it's like you have to learn all over again how to breastfeed with like your shit, basically.
Yep. And then having that pelvic floor PT in your corner.
Right.
Along the same vein of these different resources and help, like I also just think, and this is not going to come to a surprise to anybody who this isn't the first podcast that you've listened to from us, but you got to accept help. You got to ask for help.
Yeah. Gotta line that up.
Yeah. Like oftentimes it does not matter whether this is, you know, a C-section with your first baby or your fourth, but I am thinking you need help no matter what, but I am thinking about the person having the repeat C-section. That means you have another kid or kids at home.
Right.
And so have help lined up, have help from family, from friends, from maybe you already have a caregiver, like maybe it's extra help from caregivers, and have that lined up. What other things do you normally do for your family, right? Are you the cook in the house? Can you have somebody help with cooking? Right. Do you take care of other domestic things in the house, like laundry
up and down the stairs, putting away in the drawers,
dishes,
like, bending over to do the dishwasher? Yeah.
You want help with all of those things.
Gotta
and again, this is for everybody. This doesn't matter if it's you're having a scheduled C-section with your first, with your fourth, if you had a vaginal delivery, like accept help of any kind. But really think, you know, especially if you have a scheduled C-section, really think about the help that you can line up and have for yourself, for older kids, for your partner.
Yeah. And line up more than you think you need. Yeah. More. Because number one, you're going to end up using all of it.
Yep.
I promise. But number two, if you really needed to cancel somebody or lighten your load later, that's so much easier.
It's easier to cancel somebody, than to ask for help, like
totally,
if you're desperate. Yeah. So those are, I mean, those are a lot of tips. So let's call it a theme of 6-ish tips.
Our bestest tips for you.
Yes. Yes. And if you have anything to add to this list.
Oh, we left one out. I'll say it really quick.
What
high-waisted underwear and pants.
Yeah.
So the mesh underwear at the hospital, bring a ton of it home, even if you're not really having a lot of bleeding, just because it comes up super, super high on your belly and it's soft. So you can pull it up over your incision and you can wear that for a long time.
Yeah.
And pants too. Just like, you don't want
the elastic
or
directly on the incision.
Yeah. So maybe like you're really, really low or really, really high, but like not touching.
Yeah.
No thanks.
Or like, honestly, like one of the like postpartum like nightgowns. Yeah. Or robes. Like use something more like that where you don't actually have the
pants
elastic.
Optional.
I know.
Pants optional.
Where you don't have the elastic right on your incision site. But that's a good one. I'm actually glad that you said that.
Yeah.
That was one that's like come up a bunch, and that was like
so
one that my sister
simple,
gave
but
me
so life-changing.
Yeah.
Right.
Okay. So those are our tips for your scheduled C-section. Obviously, if you have anything to add, Emily just thought of one that she just added. Let us know. We're happy to add more stuff to the list, but at least this is a hearty list to get you started as you go into your C-section.
Yeah. I think if you're having your first time C-section and you do really want to learn more, we have an entire sort of video on what to expect from like real start to finish if you want to watch a little bit more.
Yeah. Inside our nurture program. So check that resource out as well.
Yeah.
All right.
Okay, everyone.
See you next week.
Goodbye.